good day, everyone. Bonjour, saludos, namaste, all the very socially distant greeting. Salam alaikum, guten tag. Thank you so much for joining us for 3IE's Virtual Evidence Weeks. This is the first of 5 sessions that will take place throughout May. Several of the subsequent ones are focused on cost effectiveness, but this one is rightly dedicated to the topic of evidence in the time of COVID. I'm Marie Gardner, and I took over as the Executive Director of 3IE, the International Initiative for Impact Evaluation, in February of this year. First of all, thank you for making time to be here in this virtual space with us. I'm sure all of you are doing what you can to balance your professional commitments with personal ones. Not always an easy task these days. We at 3IE really respect and admire your efforts to stay engaged with the evidence movement through this global crisis. We came up with 3IE's Virtual Evidence Weeks instead of our originally planned London Evidence Week, in response, obviously, to the ongoing COVID-19 pandemic. We realized that the topics we had planned for the original conference were actually even more relevant now. We believe that now, more than ever before, decision makers urgently need actionable evidence that can improve people's lives. We also know that when there is a crisis and limited resources, the urgent tends to trump the important, and being seen as doing something will take precedence over gathering data and evidence to know whether what you are doing works. So, what can we do about it? Well, we can bring the discussions to you at home. We have designed these virtual engagements to ensure you hear from leading experts, learn from their experiences, and have a chance to interact with them directly. The event is, well, first of all, let me say, before we start our session, I want to go over a few housekeeping rules. The event is being recorded and streamed live on YouTube. The recording will be made available soon after the session is over. If you're joining us from Zoom, please put your questions in the Q&A box. For all other comments or more sort of a more technical nature, for example, or just information sharing with other people online, please use the chat box. If you're joining from YouTube, post your questions in the comments box. Please keep your questions short and to the point. We might group questions where possible. And given the large number of attendees today, I'm seeing already 428 and counting, so this is very exciting. Well, we may not be able to take all the questions that come through. I think that's pretty certain that we will not be able to. So we apologize in advance and are happy to find the best way to engage with you after the event. If the event is disrupted due to any reason, such as a major technical fault or hacking or trolling, we will be forced to shut down the event immediately and will communicate the next steps to you via email. The session will run for approximately 90 minutes. We will have opening statements by each of the panelists on their reflections around the role of evidence during this crisis. This will be followed by a Q&A with me. And during this time, you, the audience members, will be able to submit questions online, as mentioned earlier. And then we will move to the audience Q&A session, during which we will select some audience-submitted questions and pose these to the panel. And then finally, we will wrap up with a short statement from each panelist. So, without further ado, I will now introduce each panelist and let them have their opening comments one at a time. So let me start with Amos Njuguna. who is the Dean of the School of Graduate Studies, Research and Extension at United States International University, Africa. He has a background in financial economics and over 15 years of experience working on financial products, savings behavior, and financial systems in both the public and private sectors. He's also the chair of the Network of Impact Evaluation Researchers in Africa that is advancing work on decision-focused evaluations of social and development programs. His research has impacted on policy outcomes in the Kenyan retirement benefits industry, insurance industry, and public governance. So welcome to you, Amos, and over to you for your opening remarks.
Thank you, Marie, for the introduction. I'll start by introducing the Network of Impact Evaluation Researchers in Africa. We call it NIERA. It's an independent network of East African scholars that conducts decision-focused evaluations of social and economic development programs. Our membership currently includes about 30 alumni of the East Africa Social Science Translation Collaborative, which is a multi-institution research network that is hosted by SIGA and is based at UC Berkeley. So our focus broadly is to develop capacity in decision-focused evaluation research, and I'm happy that it's inspired by 3IE thoughts on decision-focused evaluation. And what we do basically is that we generate, disseminate, and promote use of evidence in practice and policy making. Now, in the context of the COVID-19 pandemic, our view is that we must rethink the delivery models to be able to continue to generate evidence and remain relevant in the evidence-informed policy movement. To us, the speed which we generate evidence is very critical. And we are doing this in a context where many of our respondents are the worst affected by the crisis because of limited mobility, and therefore innovation becomes a fundamental component of our approach, which requires evaluating the capacity to generate evidence and adopt robust methodological approaches. In response, and just quickly, on some of the things that we see shaping and unlocking is that we must have rapid evidence response. And in this case, we've got two basic approaches that we have done. We are currently undertaking a continuous survey to assess the impact of COVID-19 on workers in the Kenyan informal economy on a monthly basis. We are getting some of this data. We'll be talking briefly about that. And of course, the results of the indicate various social and economic behavioral impacts. And what this has done is that it has already informed some of the county governments in Kenya. The county governments are some resemblance of federal government to extend licenses, waive licenses for micro and small businesses, and expand market spaces to cater for distancing and establishment of a telepsychology program. Secondly, we have also conducted and checking to see within the context of COVID-19, what does this mean to the researchers? And basically we are guided by the philosophy of credible evidence, ethical research, and being realistic and pragmatic as much as we can. I will be happy to discuss as we move on. Thank you.
Wonderful, thank you so much. Very important, especially credible, ethical, pragmatic, sort of stuck in my mind from what you talked about in terms of the importance of the evidence right now. Let me move straight to the next panelist, which is our very own Bitter Snilstveit, who is the Director of Synthesis and Reviews at 3IE and the head of 3IE's London office. She's a leading expert on evidence synthesis methodology, having led work on mixed methods, theory-based systematic reviews for international development, and spearheaded the development of the evidence gap maps, or also known as lovingly as the EGM methodology at 3IE. She's an author of methods papers and systematic reviews and EGMs on a range of topics, including land use change and forestry, education, WASH, agriculture, social cohesion, health, and transparency and accountability. She's also an editor of the Campbell Collaboration International Development Coordinating Group. So Birte, over to you.
Thank you, Marie. Can you hear me okay?
Yes.
Yeah, okay, great. Thank you. It's great to see so many people attending, new and old friends from all around the world. So a few opening remarks from me. So I think that the COVID pandemic brings the importance of high quality and timely and relevant evidence to the fore. We have a global crisis of a scale we've perhaps not seen for a generation. And over the last few months, we've all seen changes to our societies and economies and ways of life, which months ago appeared unimaginable. And many of these radical policy measures to control and manage COVID-19 are made and justified with reference to evidence. And while, of course, there is a debate about what the evidence says about different lockdown measures, etc., evidence is playing a key role in shaping policy response to control and manage COVID.
Birte, you froze. Let's see. Do you hear us?
I can hear you, yes.
Okay.
Can you hear me?
Yes, you froze there for a little while. Please go ahead.
Okay, all right. But I think that the role of evidence in addressing the socio-economic crisis is less clear at this stage. And I think there is a high risk that in the rush to act, well-intentioned responses are focused on doing something, and a prevailing notion that we don't have time to wait or to consider evidence. So I think that the challenge of having rigorous, relevant, and timely evidence available, combined with the limited attention span and rush to respond, makes the challenge of promoting evidence-informed decision-making even greater. But the stakes are also higher, and I would argue that the work of the evidence movement, of which I consider all of the panelists and the participants being part, that our work in both producing and supporting the use of evidence has never been more important. But I think there is a risk of duplication and information overload at the moment. Pandemics are characterized by exponential increases, and COVID is no exception. The Economist reported yesterday that this also applies to the research on to understand and control COVID. So over the last 3 months, more than 7,000 papers have been published on the pandemic, with a fifth of those being in the last week. Whilst the volume of research and knowledge products has perhaps not reached those levels yet for the social sectors, I wouldn't be surprised if we're getting close. As I'm sure that you also all notice from your inboxes, and you know, there is an explosion of new COVID initiatives and policy briefs and research, etc. So for example, I asked one of our research assistants to pick a topic and spend 60 minutes to identify as many policy briefs and guides and resource hubs focused on this topic during COVID as he could. And he picked education, and he identified 69 briefs and hubs and other resources. And he concluded that I think I only scratched the surface, and I was only limited by my own ability to click around and copy and paste into my Excel sheet. Similarly, colleagues at the Africa Centre for Evidence have recently identified over 200 COVID-focused evidence hubs, mainly focused on health. And at the moment, there are at least over 10 different trackers focused on tracking policy responses to COVID. So I think that this flow of information at the moment is in many ways magnifying the existing challenges of the evidence infrastructure, which is a lack of coordination between funders, between researchers and users, challenges of duplication, information management, curation, and variable quality of evidence. Which brings me to the third and final point that I want to make, which is about the role of evidence synthesis in responding to the current crisis. At a time when timely evidence is of essence and collection of new data is challenged and severely affected by the pandemic, it's especially important that we make the most out of existing evidence. And this is at the core of evidence synthesis. We focus on making the most out of existing evidence in a systematic and transparent way, with the goal of improving outcomes and reducing waste. So at 3IE, we've therefore partnered with our colleagues at the Africa Centre for Evidence and the Global Evidence Synthesis Initiative to develop a evidence synthesis response to the COVID crisis, where we are focused on providing easy access to rigorous and timely synthesis to inform COVID-19 responses in low and middle income countries. So as part of this initiative, we will do a number of different things. We will use the infrastructure that we already have. So some of you might be aware of the 3IE's development evidence portal. We are preparing a COVID-focused collection of systematic reviews that will be available through that existing portal. We will expand the scope of the portal to also include rapid reviews and to also register rapid reviews to act as to help prevent duplication of work. And we will also aim to establish a fund with contributions from different funders to support the production of new and updating of reviews on questions of relevance to COVID that don't exist already. And so finally, to ensure that this work is responding to real demand and target the priorities of decision makers, we are launching a survey today where we aim to get the views of decision makers and advisors and practitioners funders in particular, to help identify priority questions in the current crisis. And so my colleague will post a link to that survey in the chat, and I encourage you to help us by filling out our survey. Thank you.
Great, thank you very much, Peter. And a slightly different angle there. With, yes, one thing is the need for evidence. The other thing is there is actually quite a lot out there, and in some senses, is there maybe an overload and a need to coordinate and synthesize what is already out there. Thank you. So let's move to our next panelist, which is Amanda Glassman. She is the Executive Vice President and Senior Fellow at the Center for Global Development, and also serves as Chief Executive Officer of CGD Europe. Her research focuses on priority setting, resource allocation, and value for money and in global health, as well as data for development. Prior to her current position, she served as Director for Global Health Policy at the Center from 2010 to 16, and she has more than 25 years of experience working on health and social protection policy and programs in Latin America and elsewhere in the developing world. So over to you, Amanda.
So much, Marie, and thanks to the other panelists. I'm definitely going to be using some of those killer, the 7,000 COVID-19 papers published and a fifth of them last week. It's just overwhelming. I think it's sort of better. What do we need better evidence and for what? It's obviously about the health impact of COVID-19 itself, as well as the collateral effects on other disease control priorities in the health system, and then how to design and adjust interventions to limit the spread of the disease and to reduce the economic consequence in very heterogeneous settings. And that heterogeneity is really something I want us to keep in mind as we have this conversation. The other big issue is that the basic data that would feed evidence is missing or incomplete in so many countries. And that would require that we put our attention on building the basics infrastructure while using what we have to respond to policymakers' demands in real time. So just a couple points. One is that the basic data on death and disease is either missing or hugely incomplete. All of us feel very jealous of the United Kingdom's Office of National Statistics in health facilities by geographic area, by cause. You can compare in real time year on year. You can see pneumonia-like illnesses by week. This enables policymakers to see what's happening in real time and adjust priorities. But in contrast, in developing countries, the UN Statistical Division recently found that like less than half of all deaths are even recorded in places like Ghana and Kenya. 2016 burden of disease study finds that 38 out of 55 countries don't produce any reliable data on cause of death between 2010 and 2016. Childhood pneumonia mortality, this is the basic pneumonia that we would want to watch as we watch COVID-19, is still estimated based on in 2013, some researchers found like 8 studies published and unpublished on hospital admissions for respiratory conditions in sub-Saharan African countries. So we're starting at this very low baseline. Even in Brazil and Peru, countries where Marie and I have worked a lot, these are rapidly growing upper middle income countries. The best data on deaths is coming from burial providers and not the health system. So I'd say we have kind of an emergency on basic data to feed the evidence. And when we look at the models that are being put out without real world data and evidence, they're not going to be particularly useful, and they're possibly harmful. I mean, I think we've invested a lot in modeling, which is great to estimate deaths using indirect methods and the impact of policy measures. But on its own, modeling is not as useful as it could be without better empirical data on the basics. And that was true when we saw the difference between modeled estimates of HIV prevalence versus what we saw in a sero survey that was representative at the population level that measured that same indicator. And unfortunately, our resource allocation are based on like the first piece of evidence that hits the market. So I think we need to think about this opportunity is not an opportunity, it's a disaster, but can we build real data-informed structures so that we can minimize these kinds of perverse effects? I think to do that, we need more refined instruments and quick feedback loops to gather empirical observations and test models with real-world data. A couple of ideas on how. Some countries were already making efforts to triangulate different existing data sources to get a better picture of what's going on. Ethiopia comes to mind. They were linking censuses and household surveys with disease surveillance, supply chain, and other kinds of administrative facility data. I'd say most of those efforts were incipient and partial. What it told us more about was how bad the data was than what we could say about what was going on. But I think it can give you a rough sense distribution of baseline vulnerabilities is, and the ability of households to comply with some of the public health measures that we're asking people to do. And also gives a sense of like, what are the potential collateral effects on other disease control priorities. I think we have a lot of data from what I would call non-traditional sources, and going back to that issue around the burial data. I mean, maybe it's the case that the notary's office has better real-time data that we can use way that data is currently being reported through multiple levels of bureaucracy and say, hey, here's an easy reform we can do. In the meantime, let's start getting data directly from those frontline facilities. We have all the technology, but there's some more to do there. I think the other opportunities around demographic surveillance and sentinel sites, ongoing panels and sampling, the mapping, satellite geospatial data, drawn against the census, the mobility data that people are using, obviously, in the high-income countries and very intensively. The data, the exhaust that's coming off some of the social assistance programs, like cash transfers, lots to do there. And then finally, using the existing synthesis and evidence that we have. I really like 3IE's recent synthesis on hand washing. I liked very much the work that was done on looking at vaccine delivery. This is still relevant. So the question is, okay, well, how do we scale up the safety aspects of these and try and get to shut the gap? I'll stop now, but I want to come back and talk about the place that who the client is for the evidence, and the different ways that countries are setting up mechanisms to use evidence in real time and improve the whole system. So I'll stop there. Thanks.
Great. Thank you, Amanda. And really there a call for action. This is partly some desperation around the emergency around basic data, but also some hopeful new types of data and ideas on what to draw on. So thank you very much for those opening remarks. Let's move straight along to Norma Altshuler, who's a program officer at the Global Development and Population at the William and Flora Hewlett Foundation. She manages a portfolio of grants designed to increase the use of data and evidence to improve public policies and in developing countries, particularly sub-Saharan Africa. Previously, Norma helped found the Global Innovation Fund, where she also built a grant portfolio supporting evidence-informed innovations in developing countries. And prior to that, she was a portfolio manager at USAID's Development Innovation Ventures. And Norma has also worked for several social enterprises and nonprofits in East Africa. So over to you, Norma.
Thanks so much, Marie. And thank you to all of your colleagues behind the scenes at 3IE who were part of bringing us together at a moment when learning from each other is more important than ever. As Marie said, at the Hewlett Foundation, we work with lots of organizations, lots of nonprofits, research centers that are really in the trenches on advancing evidence use. And as a result, I have the privilege of a bit of a field level view of learning from where lots of organizations are trying to help governments use evidence to respond to the health impacts of COVID, to the long-term economic consequences. And I'm seeing lots of great ways that evidence champions are succeeding, and also, frankly, ways that partners are struggling. So I wanted to share some of my takeaways with all of you. And my bottom line is that this moment calls for us to accelerate 3 emerging trends in evidence-informed policy: rapid evidence, responsive evidence, and relationships. The rapid part goes without saying why COVID's highlighted that we need evidence fast and that information is imperfect. even in the countries that Amanda talked about, like the UK with data systems that we're jealous of, we still have a lot of uncertainty around what will happen with COVID from a health perspective, never mind economically. But we have learned that evidence, even when imperfect, can save lives. And so we need to be working with the best judgments we can now, even if they're more about probabilities, and focus on the kind of rapid evidence that is genuinely useful and not just distracting noise. I'll give you some examples in a minute. Responsive, which is really about speaking to the realities of local contexts. As Amanda said, this is very, very heterogeneous. What's going to work in Mumbai is very different than what is going to work in a suburb of California. And really speaking both to what the needs are, but also to the priorities on decision makers' minds is critical now. And finally, relationships, that the long, deep partnerships with governments so that they turn to you for help in situations like this. As Bertie said, there's beginning to be a bit of information overload. And frankly, plenty of decision makers don't have even the 1 hour that Bertie's research assistant had to just go scouring for evidence, never mind to draw on the best of it. What I'm seeing is, like all of us, where decision makers turn is where they have existing relationships. So the work that 3IE and others have done to help support a field of local researchers is something that I'm really seeing pay off now, and something that I think has some challenges about how we further support in this complicated time. So let me start with 2 examples to help make this come alive. The Africa Center for Rapid Evidence and Synthesis at Makerere University, which Bertie referred to, is helping both the Ministry of Health and districts figure out how social distancing could be implemented in Uganda. So how do you social distance in a slum? You can't tell people to just stay in their houses or they won't eat. But they've helped figure out smaller, manageable internal boundaries that don't endanger access to basic needs like food and health services. They also, to the rapid point, helped district governments interpret and apply WHO guidelines weeks before the Ministry of Health, which was quite overloaded, was able to offer district support and guidance. So this work is, very responsive, coming back to my 3 R's, to Ugandan realities, but it's also based on people with systematic review expertise who are applying both from just simple common sense, but also research chops to tailor recommendations made in Geneva to the realities of Uganda and to look for the best available evidence in the literature. I'm also inspired by work done to gather data remotely to help us respond. Number of examples I'll share later, but one for now is ID Insight's data on demand work. Before COVID, they built a platform that was representative of 100 million of India's poorest residents across 8 states. And after COVID, it took, guess how many days it took? 4 days to get data representative of 100 million people to the Prime Minister's office, which is already playing into work that the Prime Minister's office is doing on economic relief and national behavior change strategies. Here, in both of these examples and many others, what we really see is that what the rapidness matters, the relevance matters, but here the relationships really play out. That work that these partners and others have done to solve decision makers' needs over time, even frankly when those needs might not have been what we thought were the most important evidence priorities, means that there are relationships of trust that play out now. Before I close, just want to say one challenge that I'm hoping we can talk about in this panel is that relationships are just harder to develop and to maintain now. So I'm eager to hear whether there are ways that the evidence community can be a bit more coordinated in terms of working with decision makers that different ones of us have access to, and how we build relationships with researchers across continents, which are important now and tricky in the best of circumstances and even harder now. So excited to continue the conversation.
Great, thanks, Norma. Excellent point. I was just thinking about it when you were speaking. Excellent point around the relationship and trust as very much part of the equation with the evidence brokerage, and how much more difficult it may be now. And with innovative minds, we might find ways to still do that. So excellent point. Thank you. So next, we will go to Iqbal Dhaliwal, who is the Global Executive Director of JPAL. Based at MIT's Economic Department, he works with the board to develop the organization's strategic vision and with the leadership of the regional offices to coordinate research, policy outreach, capacity building, and operations worldwide. He is also the co-director of JPAL's South Asia office, the Innovation in Government Initiative, IGI, and the Innovations in Data and Experiments for Action Initiative. He is a board member of the NGO Nora Health, and he is also a member of, and there we have my change on my screen, let's see. He's also a member of groups of experts convened by the Chief Minister of Punjab, India, to develop the post-COVID economic strategy for the state. Very exciting, that last part, which I did not know from before. Iqbal, over to you.
Great, thanks a lot, Marie, and to 3IE for convening this really interesting panel. I think I just want to begin by acknowledging that this is a pandemic where the primary fight against the disease is being fought on the front lines by healthcare workers, emergency respondents, vaccine developers, and epidemiologists. Those are the real heroes of this fight. My sister is a doctor in a district hospital in India, and my husband and her husband is a cop. And so while we've been hunkered down, I've been hunkered down, trying to do work from home, they are out there in the front lines fighting for this. And the reason I think this is important is that this has defined how I have thought about the response to COVID-19. And I think a lot of people, including you, our colleagues at JPAL, have been thinking that while we want to contribute when we are adding value, and not just because we want to feel relevant at this moment. So I think I just want to begin by acknowledging that that's really important. And having thought a fair bit about this, I do feel that the evidence to policy organizations like ours actually have a fairly important role to play. Evaluations have a fairly important role to play. Evidence has a fairly important role to play right away in the public health response. But even beyond the public health response, there is a second fight going on, and that second fight is against the impacts of the Great Lockdown, the deepest, widest recession since the Great Depression, and one the entire world is facing because of the shutdown. And unfortunately, the poorest in developed countries and those in developing countries, and almost all developing countries, are at the brunt of it because of their weaker healthcare systems right away, the higher number of people in the informal sector, the lower fiscal capacity of the governments, and poorer safety nets. So I think it is really important to understand, therefore, that this fight can be waged not just by the frontline workers, but also by policymakers, donors, economists, academics, and organizations like us. So I just tried to organize my immediate thoughts around this framework of the public health response and the response to the Great Lockdown. And then in terms of three sorts of timelines: the response phase that we are kind of immediately going through, the recovery phase that is coming very soon to countries as they start reopening the economy, and then the longer term resilience phase that I think is actually the one we should be most focused on, as some of my colleagues said at the beginning. So just starting with the response phase and what's the role of evidence in that response phase. I think the first part has been, I think, and I've been really heartened by this, the safety of the communities that we work in, and the safety of the surveyors who are at the bedrock of the work that we do. And I think the first response has been to kind of shut down a lot of the in-field research work. The second, I think, quick response has been sharing quick, rapid lessons on effective programs that can be used to define the public health response. And I think examples of this include messaging around social distancing and quick tips on effective online learning, both lessons which are relevant to Norma's point earlier and as well as generalizable across different contexts. And then I think a third thing which I have really found to be, which I've been most happy about, is rapid research tools, even if you would not classify that as research. And let me give you an example. So for instance, examples of this is using existing surveys that people were already conducting on phones, or people had collected banks of phone numbers. But the aim here is to then get very quick, actionable information from field to policymakers. So very similar to the example that Norma gave earlier, lots of our researchers have quickly gone back to this bank of phone numbers, called up people to ask quick things like, all the interventions that the government is saying it is doing, like providing social security nets, getting you food, are you actually getting that? And then feeding it back to the government so they know in real time what is happening. This, of course, required acceleration of many innovations, including how do you corroborate data sources by asking the same question from the government officials, but also from the citizens. But I think this is something that we should be really proud of, how we have used our research tools without worrying whether it actually leads to research results or not. So coming to the phase that we are all about to enter, which is the recovery phase. I think in the recovery phase, what I'm seeing is that a lot of folks have launched or are about to launch quick experiments to understand which innovations work and which ones don't, not just about public health, but things around reinforcing messages around social distancing, getting migrants to return to the places where they left during the crisis. We've all seen these great walks in developing countries like India. But I think most importantly about dealing with the effect of the great lockdown on things like anxiety, depression, addiction, intimate partner violence. I think there is a lot of anecdotal evidence that those are seeing a spike. And so I think it's really important for researchers to start preparing and to start doing the work to get to this quickly in the recovery phase, especially in case there is a second phase of lockdown that happens if the pandemic comes back. And then I think the second point in this recovery phase is the importance of what I call safe evidence generation. Evidence generation, which is much more relying on mobile phones, which is obvious thing, but also using things like electricity usage, satellite imagery, for doing things like means testing, rather than going house to house and figuring out what the, whether somebody has particular sets of means or not. And then I think another thing which is very important is what I also, like Norma, call relationship building, which is using the existing relationships that we have to build these research projects and then to feed it back. And I think one thing which will serve us well here is the initiatives by organizations like 3IE and JPAL on research transparency. So issues around data publication, trial registration, data catalogs can help us prevent a duplication of work, B, better sharing of data, and C, combining data sets in unique ways that allow us to draw more lessons than an individual study on its own can do. So I think all the investment in research transparency of the last few years will pay off now. And so the final phase is, I think, the resilience phase. And I think the question that we have to ask ourselves is, what if this pandemic does not go away? What if it comes back? What if the vaccines are delayed? What happens to developing countries in the next, or all countries in the next 12 or 18 months? And I think some of the things that need to happen are, first and foremost, harnessing more the power of the large administrative data sets that the world is now sitting on. Again, the wave of digitization that we have seen in developed, but mostly in developing countries in Asia, a little less, but still in Africa, means that governments are sitting on treasure troves of data. And this pandemic has made it so, it almost feels criminal that the governments and big NGOs are receiving this data, but not being able to access it and analyze it in real time to provide understanding of the context, to design innovations, to test them in quickly and make these insights available. I think the last point I want to make in resilience is something that Amanda touched upon earlier, which is that I think this virus is actually, even though it seems like it is a huge human loss and a loss to the economy, it is something that will get under control. It's only a matter of time and money that we'll have a vaccine, we'll have rapid testing, we'll have tracing, we'll have effective treatments, we'll have surge capacity beds, PPE is going to be produced. But I think it is important to remember, and so this battle is going to be won, but the battle that we have been fighting against poverty and for the last 10 years against climate change is a battle that has been going on for about 75 years, at least since the Bretton Woods Institutes were created in 1970 and 45 with the World Bank and others. And while we have made appreciable progress, there is actually much more left to be done, and the victory is actually far less uncertain and far more distant than the victory on pandemic and on COVID. So, we just have to remember that it was only 5 months ago that Greta Thunberg was standing up against climate skeptics, and we felt that was the biggest threat to our survival. And we must remember that that is still going to be one of the biggest threats to our survival. We are still going to see lockdowns of schools due to extreme heat days extending for 4 months in tropical countries. We are going to see droughts and hunger, not because of pandemics, but because of arid fields. We are going to see migrations due to coastal flooding. And so it's very important that we make sure that we are not shifting all our resources and our research focus on something that will get under control while bigger challenges remain. My final point is that I think what has been fun is to see, turn on evening news, even on local channels, and to see people discussing RCTs every day. There are treatments for COVID which are being discussed. There are vaccine trials which are shown in so much detail, right down to the size of the treatment group and the comparison group. And I hope this curiosity and this greater awareness of how science can play a really important role in fighting the epidemic also translates into a deeper understanding of how evidence and data, and done the right way, can help us fight the fight against poverty and climate change. Thank you.
Wonderful. Thank you so much, Iqbal. Yeah, I was just thinking, somebody said the other day, never have so many across the world sort of known what a control group is. And it's really, in that sense, a moment for evidence, or could be. A couple of just a plug I'd like to make that you also, both you and also Amanda to a certain extent talked about is the issue of big data. And so a little plug for 3IE that we are in the process of finalizing a map of use of big data across the SDGs. And so that's coming up later in May. And I think that is going to be one of the very important type of resources that we can use more of. Another just quick note that was struck a chord in what you talked about, Iqbal, was in that last of the 3 Rs, the resilience phase, etc., the forward-looking. I think there's also a big challenge to the evidence community to understand forward-looking work and research, draw much more on modeling, draw much more on simulations, together with impact evaluations and other type of evidence. So I think that's also something that will be good to bring into the discussion here. Now, we will move straight into a few questions, and very much building on the first area. We talked about we're in the response phase, where we have short timelines, etc. And the question is sort of how can we shorten timelines for evaluation and synthesis to respond to immediate needs for evidence? Some of the panelists have talked somewhat about it, but relatedly, my question is, if the answer is that we can, and we've heard all the panelists in different ways saying we can, well, why haven't we done this before? And relatedly, then, if the answer is partly, well, sort of, it was something about quality or the type of things we wanted to look at. So what will give in the process? Will it be speed at the price of quality, or is it a different type of evidence needs that we are now responding to? So that first question, I would basically ask first Norma, and then Iqbal and Birte to talk to. I will not repeat it, so I'll just pass it along to each of you to say a few words on this question. Norma.
Thanks, Marie. I think that we have seen some progress in methodological innovations that help with rapid timelines that are being applied now. And we'll certainly get the thoughts on why those trends haven't been faster and how they could be. Things I'm excited about are about faster ways of gathering information and, as Birte said, rigorously applying what data we have right now. So methodological innovation. I'm hoping Iqbal will say a bit about the work that JPAL has done on administrative data being at a high enough quality point that it can be both used in programmatic response, and also in more rapid evaluation. JPAL is one of many players working on this important space. And I also have seen exciting ways of remotely measuring short-term outcomes as proxies for impact in ways that are, I find, quite responsible, even if they're short-term. So geospatial evaluations, which aid data played a huge role in pioneering, can help us assess things like climate change, crop yields, nighttime lights as a proxy for well-being from space, no risk of COVID spread. And I'm also excited about something called rapid impact evaluations, which the Botswanan NGO Young Love played a key role in pioneering in consultations with JPAL colleagues of Iqbal's like Rachel Glenister and Stefan Durkin. So the basic idea of a rapid impact assessment is that you measure short-term, but still meaningful outcomes, and that you randomize at smaller units, like individuals. To get technical for a second, when the risk of spillovers is pretty small, it's worth the increased sample size. So for example, right now, while Botswana's schools are closed, Young Love is working with the government on remote education. With Peter Bergman at Columbia, they're using rapid impact assessments to test whether they should spend scarce staff time calling parents or just text them. They can measure how much students are engaging with remote learning, but also how they perform on a problem of the day. So that's a meaningful short-term education outcome. These are the kind of results that can help them and others figure out how low-cost remote education can actually have impact or not on educational outcomes. You know, to your point about the trade-off, Marie, it's true that if we only look at short-term outcomes, we have less certainty. And there are ways that we can use preliminary information like this to test it more robustly. This is something that Young Love does. They, after putting promise with this rapid testing, do fuller randomized trials. But in the meantime, I would argue that a different kind of quality and a different kind is speed, and that we are delivering remote education right now, whether we like it or not, and we might as well use the best information we can to improve it. I also think that I'm excited, as I mentioned, to see applications of existing data, including modeling work, which I think is becoming even more important. We're all thinking about modeling quite a lot as we read about the COVID spread. But as we think about the response work and the longer term effects, I think applying existing synthesis and evaluation work in a way that models different options, not just that says these programs have been effective, is particularly helpful to governments. So for example, the Transfer Project, a partnership between UNICEF, the Food and Agriculture Administration, and University of North Carolina researchers that 3IE has also supported, along with Hewlett, has worked for 10 years to help African governments use impact evaluations to improve social protection programs. So what do you do right now? You can't really run new impact evaluations without endangering your staff. And you also need to move more quickly. Well, helping governments use modeling to figure out how to make limited social protection budgets go as far as possible. So for example, right now, Zambia and Kenya are really worried about urban groups and want to target cash to them, but should you be targeting based on demographic, based on sector of employment? Should you be going deep? Should you be helping many people in an intensive way? Should you be going broad and giving small cash transfers to many? Modeling based on the existing demographic and impact evaluation data helps provide better informed choices. And finally, I just want to say that I don't think we should shy away from common sense. I mean, to your point, Marie, about why hasn't this happened faster, I think that many of us are so careful and cautious and so driven to be grounded in robust evidence that we shy away from saying something like, gee, maybe it doesn't make sense to take your testing it's not our natural inclination to say testing should be done at as local of a level as possible. But groups like the Makerere Research Center that I referenced earlier are helping governments just apply that common sense advice. And so I hope that the urgency of COVID around the need to be rapid and to be responsive can help organizations that have relationships with governments apply both good measures that can move more quickly, but also just common sense that may not be the natural instinct and training of evidence professionals to this moment.
Great, thank you. Excellent. Let's move right along. Iqbal.
Yes, hi. So thank you for that really important question. I think I would just actually argue that, Marie, what we are seeing, this rapid response, is actually the benefit we are getting from the investment that we have made on all the world has made in the last 15 years in building the evidence to policy movement. And let me just break this down into 4 or 5 pieces. Number one, I think this rapid response is because of a lot of the methodological innovations that have come exactly as you described. But these innovations took time and effort and pain to develop, and they were being done. It's just that the light is being now thrown on them. Things like satellite imagery. We have studies from 7, 8, 9, 10 years ago, which was using satellite imagery to understand how the Brazilian rainforests are being deforested and how do you structure incentives around them by Seema Jayachandran. And so, things like the use of mobile phone collection data, people like Tavneet Suri have been doing that. And so I think we have built on that in a really fantastic way in this response. Similarly, as I mentioned, issues around transparency, the understanding of context, what is the generalizability framework, all of them have helped us. The second thing I would argue is that the reason we have been able to give quick response and ideas about what is social messaging, how does behavioral economics work in these contexts, is again because of the big evidence base that we now know many things that work and many things that don't work. And so even without diving deep into a massive exercise, we're able to go and tell communities that, look, social protection, basic income, these are things that work and you don't need to do experiments and tests around them, just go do it. The third thing I would say is that it's the relationships during this process that we have built have been extremely important in both directions, for researchers to kind of quickly offer their services and for policymakers to reach out. And we see this at JPAL in both directions. A lot of researchers have reached out to policymakers and said, we are here to help, let us know what you want to do. And I sit on this review board for allocating money, and we see letters from policymakers and email chains where they're like, thank you so much for reaching out. We were wondering about this question. Can you help us? And researchers dropping everything on their plate and jumping to answer those questions. So I think we are benefiting from that relationship investment. I think I also want to say that I hope this openness on both sides continue, but I would say that there is something unique about this pandemic, how unprecedented it is, how there has been no book or a guidebook to how to handle a synchronized lockdown of the world economy and the impacts that it's having, which has made people a little bit more open to evidence. When you haven't experienced something before, then you don't have an ideology, or you don't know whether to trust your instinct on it. And so I think what has been wonderful is to see evidence fill that space. Again, to see politicians, lay journalists talk about evidence and epidemiological mapping is I think really, really brilliant. And I think it's incumbent on us in the evidence to policy community to build on this momentum and make sure that it doesn't get lost. And then I think the last point I would say is hats off to donors around the world who have invested in this and provided quick funding opportunities to capitalize, to make sure that we were able to jump on these opportunities or these requests. And I think this once again shows how important it is to have not just good data, but have the resources which can be deployed quickly to answer these questions.
Great, thank you. Moving straight along, Bitte, and I will ask. So we try to keep the time. I will ask going forward as short answers as you all can make it while still answering.
Okay, thank you, Marie. So to add to what Iqbal and Norma have said, focusing on synthesis, which is where a lot of my work is focused. I think there are a number of things that we can and are doing to reduce timelines. We're constantly beating previous targets in terms of how quickly we can do systematic reviews. And so I think a key to doing that is to essentially use the best available existing approaches. Some of that is technology, so using things like machine learning, but it's also about having large and well-resourced teams, testing things like crowdsourcing, having parallel workflows, etc. So those are some of the things that we're doing kind of on a study level to try and produce reviews that are high quality, but to do them more quickly. I think another thing that we have been doing and continue to do, also thanks to generous support from among others, the Hewlett Foundation, who's one of 3IE's core funders, and the Bill and Melinda Gates Foundation and DEVAL, is to develop our evidence infrastructure. So the development evidence portal, where we are gathering, our goal is to have all impact evaluations and systematic reviews addressing social and economic interventions in low and middle income countries, both completed and ongoing. And the goal with that is to feed rapid synthesis eventually, and also to help inform researchers who are doing new projects and inform the science for that. I would say that I think that we are lucky to have this investment and to have been able to develop this portal. I do think that kind of going forward, the continued investment in things that are global public goods is important to allow the research and policy community to respond quickly to crises like COVID, but also other things that will pose challenges like climate change. Thank you.
Thank you. So one thing that has come up a lot is sort of these alternative ways of doing things rapidly, acknowledging that it's hard to do field work. Amos, I'd like to ask you, what are the opportunities for field activities, in the current context? I mean, it is extremely limited in the coming months and potentially for much longer, but how can we adapt and expand our toolkit for this context? And also, and this is a question that came in from the audience, how in your experience can researchers access people in remote areas to really understand the impact of COVID-19 on them and their lives? So over to you, Amos.
Thank you, Mari. First, let's put things into perspective. As I mentioned earlier, we are a network of researchers. So one of the things we wanted to understand is what is the impact of all this on the researchers. And what we found out is that already, as we speak, about 70% of the researchers are already not doing their field work. It's disrupted. 56% of them are working from home, and amongst those involved in the field work, only about very few of them can do this. And so, what does that therefore mean? It means that we've got to be innovative in the way we do this, because at the end of it, those who rely on us to supply evidence are knocking our doors and asking us, so what should we do? And I have a few thoughts on that. And the first one is basically to leverage on, build up on work that's already done by others. I know Norma has talked about doing good systematic reviews and all that. And building on it together with any available data that you can put your hands on, including the secondary data. After all, in my view, it's really better to rely on evidence generated yesterday than not to rely on any evidence at all. The other source is the issue of these rapid surveys, which definitely are constrained by the movement. And by that, what I mean is that already there is a lot of tension, there is a lot of anxiety. What does this exactly mean? But what we've seen working, of course, no one was prepared for this, but what we've seen working is the decision-focused approach, where you start from the end. You get to see what kind of information does the policymaker or the user of the research, if I may put it like that, what kind of information do they need from who? And then can we work together in the whole of this process to be able to come up with the results? So I will bring in the expertise. I will come in and say, okay, so as researchers, this is what we have in place. So give me that, and we weave the research questions together. And because you are already also having critical databases within the masses that you are working with, how do you also help us to reach those masses? It is true that there are some people already supposed to be implementing these programs who are already working with the groups that we are talking about. So having that synergetic relationship, weaving the research questions together, and then making it a much more of a co-creation towards the end result. Then you analyze the findings and take back the findings. What you end up doing is that you end up getting greater acceptability, and you also end up understanding them in a deeper sense. Would really come about is the issue of strategic partnerships. So what kind of partnerships are you having? And the issues could stem in, this is the population that is affected by this problem. How is the population organized in the first place? And is there a way of reaching this population? I'm not saying it's easy, it's difficult. But still, someone has to get there, someone has to inform. And so you have to make a concise decision to say, this is what's happening. And through that association or through that organization that has that critical mass, you are able to randomize. And as I put it, as I said that, the issue of the ethical protocol again becomes extremely, extremely important, because we are dealing with people, and chances are that the people we are dealing with are worse affected than us economically, socially, and psychologically. And therefore, I support Iqbal that, yes, we must go out there for research, but research for the sake of research, not at this time. It has to get out of context at this point in time. Now, also, as you do this, and as you get into the field work, appropriate research questions. We really don't have time to get the good to have. It's what is it that we need to know to inform the next quick decision. If your focus is on how best do we get food to the population in the most remote areas, then just focus on a question or two, get it answered, then you will be able to churn it out as fast as you can. And lastly, it will be important also to leverage on technology, because at least the mobile phone technology is a bit deep in many places, at least if it is a bit deep compared to any other technology. So where possible, also we can leverage on it to have deeper reach, but at the same time, going back to the element of research ethics and ensuring that that is not the time to painstakingly start dealing with people on their phone. And lastly, I would say, let's be bold. Being bold, because we sit back, we tie ourselves with the methodological considerations. Of course, we must be as scientific as we can, but we tie ourselves with the methodological considerations. By the time we unlock ourselves, the policymaker has moved on, and COVID has taught us that it's taking frightening shapes. So it just takes a frightening turn. You are busy weaving and trying to make it work the way you can measure the impact and all that. By the time you catch up, you are off the movement, and whatever you are trying to study now, again, is overtaken by events. So quick succession things that we can even monitor on week-by-week basis at this point in time, and also that will inform us post-COVID. What is it that we need to do past that. Thank you. Mario, over to you.
Thank you, Amos. Excellent points. I like that. There's a trend there between you and Norma as well. Be bold. Don't be shy. Don't shy away from sort of using the evidence, and also this issue of the ethical, the importance of being ethical about really asking only what is necessary, and in the current context, etc. Excellent points. Let me move, and soon we will come to the audience part of the Q&A, and I'm getting questions in that are tailored on your Q&As in Zoom. But before that, let me ask, and this is going to be a question that Amanda, Birte, and Iqbal can say a few words to, but I'll ask you to be short. What lessons does the COVID-19 pandemic hold for the evidence-informed policy movement? For example, what have we learned about what it means for policymaking bodies to be well situated to respond to evidence? Or, reversely, how could the evidence-informed policy movement have been better prepared to respond to the pandemic? Amanda, let's start with you.
Yeah. Now, this isn't an example from a low and middle income country, but I think that the UK's Scientific Advisory Group for Emergencies, or SAGE as they call it, is a fascinating example. It also shows how evidence can and cannot influence policy and leadership decisions, but how decisions about how transparent such groups are and how clear the evidence is in any given location can be to the public's understanding and support for the measures that need to be undertaken. So I just, when you look, I think part of this also has to do with the very siloed approach to evidence and advice that exists in our fields or in government, really, right? Where different evidence communities inform different evidence processes or different kinds of decision makers. I think what we've seen here, where we have a total system issue, it's an all government issue, and that's what I like about the UK's SAGE committee. It's supposed to put together the best advice and evidence for decision makers to support, along with some sense of how good the evidence is that they're using. And they're supposed to be providing advice in real time. And they've had a clear, they were late to influence. Some of the more the lockdowns that have seemed to be more effective in this sort of trial and error approach that we're taking to the response here. I think the other piece around the sort of the different evidence community, this is especially clear when we talk about some of the models that are out there, is that they come from epidemiology and public health perspectives, that they're not looking at collateral health effects even, and they're not looking at the economic indirect effects on health outcomes or the economic effect in general, how that affects well-being. And models have their own interesting pieces. And anyhow, I think the point is like, it would be better if we would work on this together. And so far, we're thinking about doing something in this space, but it's been hard to even put together conversations or teams where the epi modelers or the health economists are speaking with the development economists, people that work on impact evaluation, behavioral issues on the other side. So I think it's a quite interesting situation. I'd also say that many, not most, it's hard to generalize, but a lot of middle income countries, low income countries, we have like an emergency preparedness function, task force room, but many times that's not supported by a dedicated evidence operation. Some of the really good experiences with embedding A/B testing kinds of approaches within government that JPAL and IPA have been part of in the past, ID Insight, I think is really relevant here in Norway. They have a group that is, looks like it will be mandated to do kind of A/B testing with different approaches to school closures and reopenings as a way to learn what is going to work best in real time. We could be doing this in a lot of different places. and we should expand that kind of thing. But just to say, I think there is some need to build some of these formal entities that are supposed to be there to assess evidence, to ask for greater evidence, to inform government policymakers. And as all of the panelists have said before, Iqbal and you, Marie, this is the time people get why now a good study is important. Let me give you another example. I can't let another event go by without commenting on the case of remdesivir, which is the medication that has been shown in one randomized control study to reduce the duration of disease from 11 to 8 days. That's its only effect, no mortality impact whatsoever so far. Now that FDA approval, which is sort of one way of looking at evidence, is kind of automatically taken on by a lot of Latin American countries, for example, and all of a sudden patients are going to want that medicine. That's $4,500 per patient, and the trade-off with other things like hand washing, oxygen, and non-health interventions is huge. And there's very little evidence that we're giving right now in a holistic way to governments to say, well, I might only do remdesivir for a very small number of patients, and I'm going to use the rest of my money this other way. So I just want to say that this kind of evidence is important. It's in the real time, and it makes a difference to people, to real people's lives. So good that we're talking about it. Anyhow, thanks so much.
Great, thanks, and I see a lot of passion and frustration going into those comments. Very, very good. Let's move right along to Victor. Short comments on this, please.
So I think in terms of how the evidence movement could have been better prepared to respond to the pandemic. I think, in short, better coordination, better infrastructure, and governance of that infrastructure. And I think I'll actually, in the interest of time, I will leave it at that and get to some of the questions.
Yeah, no, thank you. That's very key point, and something that we all have been sort of experiencing also, in the current context. Let's move on to Iqbal to if you want to add something to this before we go to the last moderated question, and then we will come to the panel. To the audience questions. Iqbal,
great. So I think the quick three things, Marie, I would just highlight is governments, data, and alternative ways to do research. I think on the government piece, there has been this increasing sense, especially among some of the new philanthropic money coming from, let's say, the Silicon Valley, that governments are dispensable. You don't need a government to run a taxi company, so you don't need a government to run a development program. I think if nothing else, this pandemic has shown how key and central governments are to our response to public health, to all of those people who are crying that the government should decree that, we should be making face masks. I say, how can we be not thinking that governments cannot have a role in reducing income inequality? And so I think we must recognize, and I hope donors also now recognize that that's important. The second is the importance of administrative data. I already talked about that. We are sitting on this data and not being able to use it and use it in real time is really criminal, I think, because investment has gone into it, and we need to make sure that the data is used to save life. And then the last bit, again, we have all talked about it, is I think, and this is all these three answers are also like, what's the way for the movement to look forward, for research to think about how do we do research without the same level of face-to-face contact with our survey respondents. How do we creatively use those various tools to get us to roughly the same outcome that we've managed?
Excellent, great points. Let's now move to our last question in this segment. And you talked about funders as well, and this is about funders, and it's going to go to Norma. Norma, you'll get to represent funders here. What will happen to funding for development research and evidence as a result of COVID-19? How are funders adapting to the situation, and how are they supporting their grantees? I think, from 3IE's point of view, we've seen a very different sort of developments. On the one hand, there is interest in evidence. On the other hand, you can see that that funds are shifting towards the urgent, as I mentioned in my introduction, and to measures and interventions and away from research. At the same time, as we've said, that there's a lot of realization around the need to have evidence-informed policy. So Norma, if you could talk a bit to that.
Thanks, Marie. I mean, as Iqbal said, I'm excited to see that there are some funders putting additional funding into immediate research response. But I completely agree with you that we also need to couple this with staying the course on resilience for organizations that are good evidence champions now and need to continue to be in the long term, and with the kinds of basic infrastructure investments that and frankly, innovation investments that Amanda referred to. So I don't want to sugarcoat it. I know that this is a difficult funding moment now, and that as we think a few years down the line, foundation endowments will be smaller, government budgets may be smaller, and research funding is something that we have an opportunity to actively work to make sure remains a priority, and is it where limited dollars can go as far as possible. And I really think, there are things funders can do, but there are things that the evidence community can do together to set the agenda for funders. So one, I think, is some of what 3IE is doing with this webinar, which I hope will continue, which is shining a spotlight on how evidence work can, in fact, make a difference. The kinds of methodological innovations we've heard about today, the kinds of use cases we've heard about today, are not ones that the evidence that funders necessarily are thinking about at all the times, and not ones that necessarily have enough visibility. And, there I think we have to couple the busy work of execution with people within organizations who have a little bit more time, taking a step back to shine, who can't do field work, to shine a spotlight on this work. I think also equally important is trying to convince and control and nudge funders to use existing dollars to go further. So I'm really excited that Hewlett was a signatory on a pledge to action for philanthropy with 400 other funders about, if we don't need this, or if you have more important work than the report, let's cut the report requirement. If you need to repurpose existing funds to help your staff work remotely or to respond to COVID or some other outcome that's now a higher priority than your original research agenda, let's support you in doing that. But I think that we need our partners to help make the case of why flexible funding helps achieve outcomes, and particularly to do this in a coordinated way to bilaterals and other institutions for whom this is harder. Almost all of the examples I shared today came from organizations that have flexible funding and could respond to COVID faster than Hewlett or any other funder could write checks. And so I hope that if we share that example, those kinds of examples, and all tell this story together, that will help a little higher proportion of the world's funding be more flexible.
Great. No, that sounds very, very reasonable and sensible and hopeful, I would say. So thanks for that. Now I will. I've gotten a lot of questions. I might not be able to sequence them all in a very organized way, but I will read a number of questions that are coming from the audience, and I will allow each of you to say to take, basically pick the questions you'd like to say something about. So one question was, will resilience include better preparedness for all global shocks, just pandemics, or none of the above, as with SARS-1? And why didn't lessons learned after SARS-1 get implemented by most countries? Is that a researchable question? Another question that came in is around experiences of people working in governments in low and middle-income countries around evidence use. Is there some more sort of examples that you could share where you've seen that this has been done recently? The other question is around all of or a comment around. It seems like a lot of the evidence is in English, and what does that mean for researchers and research in other languages, and uptake, frankly, also in countries where that function in other languages. one thing is about, you know, the limitations and the limited possibilities of doing RCTs in quickly in the current context, and to what extent can you know, do we look to theory of change as a way to inform decision making? So some good question there. Then there is a question on how the COVID situation, what we're experiencing now, how do you think it will change our research priorities in the future? And maybe to add to that, not only priorities, but how we work together with policymakers. A very interesting concern, of course, around misuse of data. You know, how can we ensure that the data are not used to suppress the people rather than to actually inform good policy? And how can we share data but still ensure protection? And this is obviously a very, very excellent point. Then let me add a last one that I had seen. Is the development of social value metrics an even more urgent priority for the evidence community as resources into the space contract in the medium term? Resources into the space contract in the medium term. So let me pass over, and also, as I mentioned, the panel, if there's anything you've seen in the Q&A that you particularly like to also talk to instead of some of these questions, please feel free. So I'll go in the same sequence as our panelists introduced. So Amos, let's start with you, please. We lost Amos, do you hear?
Sorry, my last 2 minutes were wasted. Sorry. So I think my comment here would typically be upholding and looking at what is relevant at that point in time. Because if you look at the multiplicity of the questions that are coming, all of them are geared towards how do you harness a solid base of evidence that will eventually lead to meaningful results. In one way or another, it is a common theme that's evolving around the questions. When you look at the issue of we are generating data, it is being suppressed. How do you combine these methodologies to give you the data that is supposed to work? Do we have the social metrics? So, and availability and all that. When you look at it, it's a context of how do you get to harness. In my view, it's a long-term process, and it's something that chances are that institutions that were better prepared to generate evidence and had created proper mechanisms of generating evidence before the crisis will still be able to do the same and are most likely going to continue doing the same.
Great, thank you. Britta, over to you.
Thanks, Marie. So I'll respond to a couple of those. So one question was around how COVID will change the research priorities. I guess I hope that in some ways it highlights the importance of longer term timeframes and looking ahead, and I hope that it will wake us up to the, you know, as Iqbal mentioned, the very real issue of climate change, which will not go away. And I also think that of course there are specific questions that are related to COVID and the kind of direct health responses to COVID, but I think also beyond that, really a lot of the kind of challenges of reducing poverty and improving employment, etc., it just becomes more important and more urgent. A couple of questions relating to our planned synthesis work. So there was one question in terms of the survey. So we plan to run that for a couple of weeks, and we will publish the results and make those available. And we will then start by, in the first stage, to draw on existing high quality systematic reviews to provide collections or policy briefs based on existing reviews on those topics. So trying to get that out more quickly, and then we will move on to doing and updating systematic reviews kind of beyond that.
Great, thank you. Amanda.
Thanks. I'll take the question about data privacy and misuse. I think this is an area of policy that has not received sufficient attention, especially in low and middle income countries, and needs to be a national policy issue. A colleague of mine, Mike Pisa, will be doing some work on this later this year. But just to say, we already have very clear examples of people using the data on mobility to impose punitive lockdowns with all kinds of knock-on effects. And there's a big movement for sero surveys, blood surveys that would take blood and samples from people. And I'm not sure we are even ready to be able to regulate that kind of data collection in a way that protects people's privacy and consent and all those kinds of issues. You know, usually we use university settings to do those kinds of checks, and I think that's probably inadequate, and we need to look at that further. But that said, those sero surveys have the potential to give us better strategies to be able to shield people from further spread of disease and things like that. But the temptation to misuse it is so high. So I'm not sure what we'll say as the evidence community. We should probably think about what our recommendations are sooner rather than later.
Great, yeah, excellent points. Thanks. Norma?
Thanks, Marie. Building on Amanda's point about data privacy, which I'm really excited that CGD is playing a leading role in conversations around, the other 2 points I'd highlight are the importance of that this really is a balancing act between, we see right now where data on where people are, human mobility, other very fast data really does save lives. So how do we strike the balance with the appropriate safeguards, but not go so far in the direction of data privacy that we can't use the data that Iqbal talked about us all sitting on to solve problems? And there, I think institutions like 3IE have a great role in having mandated that people share data sets and nudging and supporting folks to get data out there faster when it truly is able to be an immediate response priority. Also wanted to speak briefly to the question about English. And there, I think that it's particularly important that we have some priority of rapid translation work, and particularly, 3IE is doing some work in West Africa on rapid response, that when other partners are doing the work that is really connecting evidence to a specific decision maker, let's prioritize scarce resources to translate those resources, much as it would be great if all research was in multiple languages. I'll pause there given time.
Great, thank you, and thanks for plugging our work in West Africa in our joint WASI program. So excellent points. Iqbal.
Yeah, thank you, and I also use this as my closing comments to save time. I think the first point we should remember, I think is important to know, is that sometimes maybe slowing down or not doing a research or an evaluation is the right thing to do. If we feel, oftentimes, we do that when we basically think that the value added of additional research or what we can do in short term may not be useful enough, or we may not have enough confidence in it. So I think that's an important point to make. The second point is, I think I agree with everything that Amanda and Norma said about data. We've got a grant from the Sloan Foundation to create a data handbook, which we were supposed to release in in May, but now we are going to do a series of online things, which bring together lots of governments, the IMF, the World Bank, everybody pulling in chapters to say what should be the data standards for the sharing and use of data. And we are hoping that this handbook, with contributions by governments and multilateral organizations like the fund and the bank, can then help governments feel more relaxed about using some of this data. And then I also went online on your advice, Marie, and looked at some of the questions that people have put. And the one stream of questions that they directed at me is that as a member of these advisory group with the government, what are some of the priorities that the government is asking us and others to think about research on? And so I'll just say quickly that that's a chapter on it, is a topic on itself, but there are 6 key things that most developing countries are looking at. The first is exactly as 3-4 other questions came about migrants. I think there is a huge migrant population that was behind the scenes, which people did not realize, whether it is Cairo or Nairobi or Delhi or Jakarta. These are people who are coming and are the backbone of the economy, and they were all left stranded by the great lockdown. So I think there's going to be a fair amount of research on how do you identify these people, how do you put them in the databases of the social safety nets, how do you make sure their children are being educated and in the local language of their native state rather than the state where they are in. What do you think about their housing? What happens when the next pandemic comes? Do they have access to health insurance? So that's a big thing, I think, that governments are worrying about. The second thing is on industry. There is both the labor issue here and also issue of supply chain. But I will say a lot of developing countries are thinking about how they can attract investment away from China. And I think there is going to be some research that comes out of it. The third is on agriculture. Lots of issues, but I'll only talk about one, which is how do you break the middlemen between farmers and the end users? Huge problem, but the COVID pandemic has made it salient because these middle wholesale markets were the first ones to be shut down because of social distancing, and it basically choked the entire system. On health, I think it is moving beyond COVID and thinking about these collateral damages, as Amanda called them. Addiction, domestic violence issues are going to be really big. And then last 2 issues, one is around state finances. I think governments are really worried. They have thrown in a lot of money to solve the immediate problem, but their bills are going to come calling. And what gets cut? Is it development programs that got cut? Is it subsidies? Do we bundle the subsidies and move them into single cash transfers? So I think there's going to be a huge amount of interest about moving from in-kind subsidies to cash subsidies, and I think hopefully a lot of research. And then the last bit is on digitization and how can you make the government more resilient using digitization. So those are the strands I'm seeing from the policymaker side as really important questions for researchers to focus on. Thank you.
Excellent. So we're slightly over time, but I had promised to get to, for each of you, if you want, and I think Iqbal, you just said these were also your closing remarks. If anybody of the rest of the panel want to sort of say, take one takeaway, sort of, or one thing you learned today, or something that's really struck you from today's discussion. And I will not try to summarize again for everyone. That will be the last words and then the thanks. So I'm not sure, is Amos still on? Amos, are you still there? Do you want to share something? I think not. So Birte, do you want to share one thing you took away from this?
So I really like Iqbal's point about essentially that, sometimes we should just kind of wait and not react to the impulse to jump, to respond, to feel useful. I think that that's an important lesson for all of us. And just a final plug for our survey, which I hope that, and thanks to the participants for joining, and I hope you would help us by filling in the survey, and hopefully a colleague can add the link again. Thank you.
Thank you. Amanda?
I see Amanda sent a note saying she had to drop, but I'm happy to.
So you get the last word then, Norma.
Goodness. Well, I first of all, I want to say that I really learned a lot about compelling priorities for data and evidence generation, some of which were on my radar and some of which weren't. And similar to Iqbal's point, I think that one thing I'm hoping 3IE and other leaders in the field can play a role in helping us talk a little more about is what are the most compelling priorities? You know, for example, I was particularly personally compelled by Amanda's point about joining up health and economic data as we think about those hard trade-offs that are interlinked, but really think that there's so much to do, and we'll have the best luck in making a case if we cohere around a smaller number of top priorities. And, you know, finally, just wanted to reiterate the point I made and the plea I made about storytelling. I think there's so much work that we've heard from the panelists today and in the chat from organizations around the world, and, you know, many more stories that we haven't heard about today around how evidence truly can slow the spread of COVID and help mitigate the difficult economic recovery we have ahead of us. And it's only with showcasing examples that we will continue momentum and continue, frankly, you know, good news and inspiration that so many of us are benefiting from right even more than ever right now. So with that, just will thank 3IE.
Thank you very much. Excellent point to finish on. I think the storytelling and also basically thanking you all for all of you out there. I'm sure are sort of evidence champions, whether producers or users, and most of us are a mix of all of that. So thanks again for joining. I'd like to particularly thank Mark Engelbert, who is has been the session lead and pulling together this great panel and the discussion. He's an evaluation specialist in our London office, working with Berta, and also thanking the whole of 3IE's virtual evidence weeks core team for putting together this really fascinating discussion. And hopefully this will just lead to more discussions among yourselves. And please join us again. There are 2 sessions next week. One is actually the launch of the evidence portal that Peter has referred to. And then the other next Thursday is around cost effectiveness and the importance of cost effectiveness in evidence-informed decision-making. So with that, thank you to everyone, and have a good rest of your evening, morning, or afternoon. Thank you.
Thanks, Marie. Thank you, 3IE.
Bye.
Thank you very much.
Thanks so much
Bye.
to the panel.